dying well, and really discovered that, wow, no, people are really not dying well. They don't know that they're even dying. Patients they're not told by the physicians and nurses that they're dying. And that was a huge problem because it left people isolated and in pain because they were not being cared for in an appropriate way for the end of life. They weren't getting the amount of narcotics that are necessary to really control pain when you're dying. So in response, hospice came on board. The first modern hospice was in London in the early 70s, and then the first hospice in the United States was in Connecticut after this woman Florence Wald went over to London and studied at the St. Christopher's Hospice, which was the first, and she brought her knowledge back and she formed this Connecticut hospice. And from there, it really skyrocketed and has just grown exponentially across the country to the point now where we have nonprofit and for-profit hospices. And that's another question that I have not looked into myself yet in terms of differences between nonprofit and for-profit. You'll see the hospice that I was at was a nonprofit hospice, and it might be very different in terms of the care and the impacts that are happening. The success of those early hospices led to Medicare allowing for hospice to be covered at the end of life. And pretty much once you are determined to, if your physician says, I would not be surprised that if you died in the next 6 months, that's when you're eligible for hospice care. It doesn't mean you have to die within 6 months. And we'll talk about that a little bit more later too. Yes?
The full care, like rest homes, does that fall into conventional care or hospice or something in the middle?
Like nursing homes?
Nursing homes.